So this actually, the symptoms I put in it does qualify for an eVisit. So you actually start the eVisit and answer more questions. It actually allows you to actually pick your provider that you've seen before. It'll be right there. And then that sends to the provider, they get that message and the response will come back into the messages. You don't have to make an appointment into that doctor's office. And it is all virtually. So everything goes through the My Atrium. The messages come back to the My Atrium. So same as you send a message to the provider. And usually the response is within 12 to 24 hours. You get a response with to either tell you, yes, here's what it is. Here's a medication that is provided for you, or instructions. Or if, you know what, we really can't treat this here, then you come to the office. So it's just another access and a way for a patient to be cared for. So these are some of the minor conditions and illnesses that you can possibly do an eVisit with. And there was one that there was a sinus infection, and they said, did you have a fever? And I said yes, and it said eVisit's not an option. You have to either do a virtual, that's a virtual option for face-to-face through the computer, or urgent care or a doctor's office. So it is a very strict guidelines of what conditions can be done in eVisit. The goal is to answer 12 to 24 hours, excluding any holidays or weekends. On the My Atrium Symptom Checker, this does not qualify for an eVisit. Here's your next option. Some of the questions, this is very intuitive, very thorough. And there's a multitude of list of minor conditions such as, urinary tract infection, back pain, knee pain, and common colds, even COVID-19. So somehow you can be, once again, another way to be treated at home, and it's a direct access to your provider. I would send a message to the My Atrium. I do believe you have this. Here's what's going on. I'm going to send this medication for you. If you have any questions, let me know. Plus, when they look at the My Atrium, they'll also say you can look at their notes, because it's your chart, and the note will actually say everything there home care needs to do, what medication was prescribed, and any other follow-up advice. I think the benefit of the eVisit is it is the direct communication between the patient and their provider.